In hepatocellular carcinoma, alpha-fetoprotein, or AFP, is released mainly by tumor cells into the bloodstream, where it can be detected by a simple blood test. AFP can be used to help monitor disease progression in HCC, and it is also a clinical prognostic biomarker. It can indicate a poor prognosis in patients when baseline serum levels of AFP are high, at least 400 nanograms per milliliter or higher. This poor prognosis is marked by increased tumor vascularization, increased tumor activity, and high tumor burden, all of which indicate aggressive disease. So AFP is a valuable clinical biomarker that can help identify patients with aggressive HCC. You may not realize that approximately 40% of patients with advanced HCC have high levels of AFP, and overall survival for patients with HCC and high levels of AFP greater than or equal to 400 nanograms per milliliter ranges from approximately 1/3 to 1/2 that of patients with levels of AFP less than 400 nanograms per milliliter. How can this biomarker reveal a path forward for patients with high AFP? Cyramza is the first and only biomarker-driven therapy indicated for patients who have advanced HCC with levels of AFP at least 400 nanograms per milliliter or higher. Take another look at AFP and consider how a biomarker-driven therapy could help your patients with high AFP. Please see the important safety information for Cyramza and link to the full prescribing information adjacent to this video. Cyramza, as a single agent, is indicated for the treatment of patients with hepatocellular carcinoma, HCC, who have an alpha-fetoprotein, AFP, of greater than or equal to 400 nanograms per milliliter and have been treated with sorafenib. The labeling for Cyramza contains warnings and precautions for hemorrhage and GI hemorrhage, including severe and sometimes fatal events, gastrointestinal GI perforations, a potentially fatal event, impaired wound healing, arterial thromboembolic events, ATEs, including serious and sometimes fatal events, hypertension, infusion-related reactions, worsening of pre-existing hepatic impairment, reversible posterior leukoencephalopathy syndrome, RPLS, proteinuria including nephrotic syndrome, thyroid dysfunction, and embryo-fetal toxicity. Cyramza should be permanently discontinued in patients who experience severe bleeding, a GI perforation, an ATE, uncontrolled hypertension, RPLS, or nephrotic syndrome. Cyramza should be withheld prior to surgery and discontinued if a patient develops wound healing complications. The most common adverse reactions, all grades, observed in single-agent Cyramza-treated HCC patients at a rate of greater than or equal to 15% and greater than or equal to 2% higher than placebo were fatigue, 36% versus 20%, peripheral edema, 25% versus 14%, hypertension, 25% versus 13%, abdominal pain, 25% versus 16%, decreased appetite, 23% versus 20%, proteinuria, 20% versus 4%, nausea, 19% versus 12%, ascites, 18% versus 7%. Please see the important safety information for Cyramza and link to the full prescribing information adjacent to this video.